Are you looking for sciatica pain relief that will work in seconds to decrease your pain and get you back to doing the things that you love doing? Today we're going to be discussing not only what sciatica pain is so you can know whether or not that's what's bothering you, but we're going to be discussing things that you can do right now at home in seconds that will help to relieve your sciatica pain and get you back to living the life that you enjoy. First off, what is sciatica pain? So many people get confused if their pain is actually sciatica. So what you will experience if you have sciatica is either low back pain, that's a sharp shooting pain, pain in your hip that can be dull, achy, or sharp shooty, or you may have pain in your calf and into your foot. Now, a lot of people who have sciatica may not have low back pain. You can have sciatica that travels down the back of your leg, and that can still be sciatica even without low back pain. But chances are good that those are one of the spots that you're really feeling the pain. Now, if you're feeling the pain down the front of your leg, that's a different nerve. It still can be a nerve problem, but it's not a true sciatica problem. So the tips we're going to discuss here today are not going to be effective if you have pain down the front of your leg. This is for sciatica, which is pain that goes down the back of your leg. All right, so what are the 5 things that you can do right now to eliminate your sciatica pain? Well, the first thing I'm going to ask you to do is to use ice. I know a lot of people think, oh, it feels better when I use heat, but heat is actually aggravating the problem. You see, heat increases blood flow, and when you have increased blood flow in a stagnant area, it increases inflammation in that area. Chances are that your sciatica is due to too much inflammation and that nerve getting irritated in the first place. So what we want to do is calm things down. We want to use some ice to do that. Now, when I have people ice, I only have them ice for 3 to 5 minutes. That's what the research indicates is the most helpful amount of time. So you don't need to ice all day, every day. In fact, actually, that's probably contraindicated. But ice for 3 to 5 minutes, and if your sciatica pain is really bad, do it every hour. This will help to not only decrease the inflammation, it'll also help to decrease your pain, which will allow you to move on to step 2. And step 2 is making sure that you move as much as you can pain-free. Now, this is super controversial because so many doctors say, oh, you have sciatica, you need to go home and rest and not do anything for 2 weeks. Friends, it is not going to get better if you don't move for 2 weeks. Now, I understand in the first day or 2 after a sudden sciatica flare, you may not be able to move because it may be painful, anything you try to do. And I understand during that time, you need to be resting. But after a couple of days, you should be able to find some motions that are pain-free. Maybe some gentle rotation, maybe walking around the house, small, gentle movements that don't increase your pain. When I have patients who have a sciatica flare, often in the first day or 2, they need to just be doing ice, some gentle rotation in their low back, and allowing the tissues to rest. However, after that day or 2, often they're able to get up and move around the house a little bit, do some gentle walking, do some gentle stretching, and get things moving. Now, chances are good that you'll only be able to do that for a couple of minutes, and then your pain will start to increase, so then you have to go sit down and rest again. And definitely make sure you take your ice pack with you when you do it. And step number 3 is just as controversial as step number 2. I need you to stop stretching your sciatic nerve. So many videos out there are showing you how to stretch your sciatic nerve in order to decrease your sciatic nerve pain. Friends, I'm here to tell you your sciatic nerve does not like being stretched, and it is going to make things worse. Now, you may be saying, but when I stretch it, it feels better for a little bit. Yes, it does feel better for a little bit because it feels like, oh, there's a change. So you've done the stretch, the information has gone up to your brain, and your brain says, oh, there's a change in that, so that's better. Except for then it realizes that there's more inflammation, which is worse. So it actually increases your pain in the long term as opposed to decreases your pain. So I need you to stop stretching your sciatic nerve, stop listening to all those YouTube videos, and make sure that all the motions that you are doing are taking stress off the nerve, not increasing stress to the nerve. Now, friends, this includes sciatic nerve flossing, which again is very popular on the interweb. So I need you to not be flossing a hot, acute sciatic nerve injury. Now, there is a time to do that when things have calmed down a little bit. So after a couple of weeks, what can happen is that inflammation can increase the tension in the fascia. And at that point, the sciatic nerve is kind of tethered down in that fascial sheath. At this point, the flossing can be very helpful because it can help move it out of that tension area. However, you'll know you're in that spot when your pain becomes more of a dull, achy, I call it almost a phantom sciatic pain, because it's not true sciatic. It's not that sharp, shooting, stabbing, burning pain. It's more of a dull, achy pain, and you feel like you want to stretch it because it feels like it's not moving correctly. Now, usually that happens after a couple of weeks, but everybody is different. So for you, what I want you to notice is my pain that sharp shooty, or does it feel like the inflammation is down because I did all the icing and I did the gentle movements, and now that nerve is just tethered down and keeps getting irritated? The fourth thing I need you to do is to discover the root cause. You need to understand what started this sciatica problem in the first place. Now, I'm going to link a video down below. It's actually a webinar that I did. In the video, we discuss specifically the different structures that can be causing sciatica, as well as some things that you can do right now. And you can go download that video right now. And the last thing that I need you to do, and this may be the most critically important step, is to find a safe sleeping position for your sciatic nerve. A lot of people who struggle with sciatic nerve pain, it gets worse in the evening and it makes sleeping very uncomfortable. So I'm going to link a video here for you where I recommend and demonstrate the top sleeping positions for sciatica so you can find one that works for you, because when you're sleeping is when you're healing. So you want to make sure you're in the best position for your body.